name's Vanessa Gormley. I'm from Massachusetts General Hospital's Fireman Vascular Center. With me today is Jennifer O'Neill, also from the MGH Fireman Vascular Center, and we're here to talk to you about stroke. Stroke remains one of the most devastating diagnoses in the United States. It's the number 5 killer of Americans, taking about 800,000 lives annually. It's also one of the most preventable diseases that occurs in the U.S. So one of the first things that we can talk about is, what is a stroke? A stroke happens when one of the vessels in your brain that carries oxygenated rich blood and nutrients gets blocked by a clot or plaque buildup. This blockage then cuts off any blood supply from the rest of the vessel. This will then make blood vessels and brain cells die and no longer work. A stroke is caused by a couple of things. A clot can travel up into your brain vessel and get lodged. That's called an embolic stroke. Another type of stroke is a thrombotic stroke, which is basically plaque buildup within a vessel, otherwise known as atherosclerosis. Every once in a while, we have a stroke that we just can't figure out the cause of, and that's called a cryptogenic stroke. There are a number of different risk factors for stroke, and my friend Jen O'Neill is actually going to tell us a little bit about that. So Jen, what are some risk factors for stroke?
So we can kind of divide up the risk factors or causes and reasons for stroke into 2 different categories. The first category are called modifiable, which are things that you can actually control. So there's a lot that you can do to prevent a stroke from happening, one of which is smoking. Smoking is bad. Being inactive, so not getting enough exercise. The American Heart Association actually recommends 150 minutes of exercise a week. So that helps prevent your risk for stroke. Obesity is a huge risk factor for stroke, and you probably have heard the term body mass index, or BMI, thrown around. So a BMI greater than 30 is considered obese. High blood pressure is a huge risk factor for stroke. I think it's actually one of the top. So if your blood pressure is over 120 over 80, that puts you more at risk. And high cholesterol is a big contributing factor as well. So a total cholesterol you usually hear greater than 200 is a huge risk for stroke. And diabetes, so people that are challenged with blood sugar control. And then things that you cannot modify, non-modifiable, things that you cannot change. So we can't change our age, but if you are greater than 55, you're more at risk for having a stroke. Unfortunately, your stroke risk doubles with every decade you're alive. Gender, unfortunately, women are more at risk for having stroke than men, and that's pretty much connected to the fact that women live longer than men. Ethnicity-wise or race-wise, African Americans have the highest risk for stroke due to their increased risk for high blood pressure, diabetes, and obesity. And studies show that the Hispanic population is also at high risk for stroke at more younger age than other races.
Wow, thank you. So what can I do to lower my risk of stroke?
So there's a lot you can do. So I pointed out all the risk factors that are modifiable or things that you can change. So exercise is a big one, right? So we can all get out, go out there, the good weather's here, and hopefully get a little more exercise. We're looking for about 2.5 hours of moderate exercise or muscle strengthening at least 2 times a week. So that's a big one. And eat what's called a heart-healthy diet. We want low fat, low cholesterol, and low sodium. So think of that low cholesterol diet is less clogging of your arteries. And what else? Let's see, quitting smoking, obviously. So smoking is going to narrow your arteries, make everything, the blood flow worse. So that's going to help. And reducing your alcohol too. So we know that people that consume massive amounts of alcohol have a higher risk for stroke as well. So there's a lot that we can do. Following up with your own primary care providers is a huge help, and they can help keep you on track.
That makes me want to call my doctor today. So wonderful. So how can I tell if someone's having a stroke?
So we tell a lot of our patients in the hospital, when they leave, the most important thing is to know your risk factors, as we've discussed, and then to know if a stroke is happening. So anything sudden or severe that you can't explain. We use the acronym FAST, F-A-S-T. So F, a sudden facial droop or face drooping, facial weakness. A, sudden arm weakness. S, sudden difficulty speaking. So if your words aren't making sense, they sound garbled, your family can't understand you, you can't get them out. And then T is for time to call 911. So if you think of FAST, F-A-S-T, think of that when you're talking about signs and symptoms of stroke.
Okay, so if I ever see someone having a stroke, what should I do first?
911. Stay with the person, call 911. This will activate the EMS or the emergency medical system, and they'll talk you through it and get help to you as soon as possible, because the faster people get help, the faster they're going to get treated, and hopefully will not have some of the deficits that we do see, some of the deficiencies, some of the inabilities and disabilities down the line.
That's great, and we can't speak enough about making sure that you call 911 and get an ambulance to your house or wherever you are instead of driving. Bad idea to drive yourself to the hospital when you're having a stroke. So make sure you call that 911 number immediately when you see someone having a stroke. Some helpful websites for additional information on stroke would be the American Stroke Association's website, strokeassociation.org. You can also check out National Stroke Association. Their website is stroke.org. And Mass General Hospital actually has their own stroke website you can go to, and that's called stopstroke.org, which has a ton of resources and more education for you and your family to help identify your risk factors and know the signs and symptoms of stroke, especially that FAST acronym. Again, it's the number 5 killer of Americans, leading cause of long-term disability. So make sure you know your risk factors. Make sure you recognize the signs and symptoms of stroke, especially that FAST acronym. And thanks for watching. Have a great day.